Hi everybody, Dr. Suneel Dhand, internal medicine physician. I was recently reading a report from North Carolina, and they were talking about children being admitted to the ICU with COVID-19, severely ill children. And there was a pediatric intensive care unit specialist who said that 9 out of 10 of the patients had obesity. Yes, 9 out of 10, 90%. That is an absolutely staggering number. The article then went on to describe how the Health and Human Services Secretary for that state had barely even mentioned the word obesity in almost one whole year. Think about that. In medicine and science, we're all about associations. Can you imagine any other situation where we would see that type of association? I mean, usually when you hear that number, red flags are going up, alarm bells are ringing, but yet we're hardly talking about it. I don't have statistics from the rest of the country. I'd be very curious to see overall numbers, but I would suspect that if numbers in other states are not hitting 90%, they are still very highly correlated with obesity. And this is backed up even by what I've been seeing. I'm an adult medicine practitioner. I've treated hundreds of COVID-19 patients, and my own unique perspective is the overwhelming majority have belonged to older age groups. But out of the younger age groups that I've seen get admitted to hospital with COVID, this has been a very obvious risk factor a lot of the time as well. And why does this happen scientifically? I've talked about this before. This is obviously a subject which is close to my heart as a physician who practices lifestyle medicine, who is very interested in metabolic health and how that is intrinsically intertwined with immune health. But this happens because it is scientifically proven that having excess body fat is a significant immune suppressant and places an unnatural stress on the lungs during a time of need. Unfortunately, we were already facing a crisis even before COVID hit, not just in adults, but I'm talking children as well. And the latest data that I've seen in the last few weeks is that rates of obesity have gone absolutely off the charts for children over the last year and a half of COVID. This is an absolute tragedy for the future health of the country. We need to urgently address this right now. I don't live in some fantasy land. I know that we aren't going to magically reverse this situation, but we surely have to at least try. Let's think about this, and each one of us probably has similar memories as well. I'm going to be very blunt here. You go back and you look at old childhood class photos, there may have been that one large kid in the class, but now you look at classes of children and it is a very different situation. We have to realize the effect this is going to have on the future health of the country. Nothing could be more important for a nation than the health of its children. These patterns are not unique to the United States. They've been repeated all across the Western world. And talking about the United Kingdom for a moment, I've obviously been talking a lot over the last few months about the situation with children and the vaccination program. The UK government, they weren't going to have a vaccination program, then they were, then they weren't, then they were. They've gone back and forth a lot. But the whole time they were saying that if children have underlying risk factors, then a vaccination, immunization would be recommended. And I was actually saying, I've said this in previous videos, that obesity should certainly be considered a significant risk factor for COVID-19 and get any child to the front of the line for a COVID vaccine. This is a societal problem that we can absolutely deal with in a gentle and sensitive way while realizing how important it is we talk about it. It needs to be a multifaceted approach going forward from medical authorities. No more radio silence anymore. This is unacceptable. This is about the future health of the country. Medical authorities, governmental authorities, and we have to take the message right to parents as well. Obviously, everything starts off at home. What are people feeding their children? Are they encouraging them to be active or not? We have to be all hands on deck with this issue. 90% in this particular article, children on the ICU with COVID had obesity. If that isn't enough to make us all wake up and realize we have a serious problem on our hands, nothing else will be. Thanks everyone for listening. Dr. Suneel Dhand, MedStoic Lifestyle Medicine. We'll speak again next time.